Hello, welcome everybody to today's webinar. It's about how developmental optometry can help reverse symptoms of autism, ADHD, sensory processing disorder, learning disabilities with Dr. Bryce Appelbaum. I am Maria Rickard-Hong. I'm the Education and Media Director for Documenting Hope, and I am your host. We are going to be taking questions at the end. So do me a favor, type them into the chat box. It makes it easier for me to manage them. I also get a little text file at the end just in case. So we are going to be taking questions at the end. So if you think of something, just type it in the chat box as we go along. And if you don't know about us, Documenting Hope is a 501(c)(3) that provides root cause healing solutions for children's chronic health and developmental conditions. We provide resources and support for parents and practitioners who are ready to move beyond the conventional symptom suppressive approach to disease management. And just a quick disclaimer about our webinar. This webinar is not a substitute for medical advice, treatment, diagnosis, or consultation with a medical professional. It is intended for general informational purposes only and should not be relied upon to make determinations related to treatment of a medical condition. Documenting Hope is not verified, does not guarantee the accuracy of the information provided in this webinar. And today, my guest is Dr. Bryce Appelbaum. He's the founder and CEO of My Vision First, with a private practice specializing in vision therapy and rehabilitations. And he has offices in Bethesda and Annapolis, Maryland. So, hi, Dr. Appelbaum. Welcome.
It is such a pleasure to be here. Thank you for having me and so excited to connect and talk about how we can all know better so we can do better when it comes to vision.
Exactly. Well, I always like to start my webinars off by having you, the guest, tell us about your story and how you got into doing what you're doing. So if you could, please tell us.
Absolutely. Well, I am a product of the work that I do. And so I have a really unique story that, I think starts really early in life. But my first memory of how vision interfered with so many aspects of my life was in first grade. And I remember being on this kind of fall afternoon on a soccer field at Cardock Springs Elementary School, and where my team was playing the Purple People Eaters, and there was this moment where so clearly I can recall it, where I'm the lone defender. There's these kind of three attackers on a breakaway coming at me. It's just them, me, the goal behind me, and I completely freeze, like my legs are stuck in quicksand, and these guys just blow past me and easily score. And I remember feeling really kind of lost in space and afraid and helpless and so upset that I let my teammates down, essentially kind of giving away the goal to the other team. And so at the time, I had these visual developmental delays. So what that meant was I had trouble focusing my eyes, I had poor depth perception, and my eyes didn't work well together as a team, really causing me to freeze in moments where I should have sprung into action.
Okay.
So that night at the dinner table with my parents, I had a complete breakdown. All the tears came pouring out, and I shared how I didn't know what to do on the field, where to be, how I was so lost in the classroom, couldn't see what the teacher was writing on the board, having asked my friends for help, and even walk up and pretend to sharpen my pencil on those old school pencil sharpeners. Remember
Yes.
those? To kind of sneak a peek at the board for what the teacher was writing. And I worked hard in school, but I was a reluctant reader. I would find myself flying through other subjects like math to kind of compensate for my deficiencies with reading. And because of vision, I had this negative confidence that made me feel like a turtle retreating to my shell in so many aspects of life. Fortunately, I had the perfect parents. My father was a developmental optometrist, my mother an occupational therapist who specialized in sensory integration dysfunction. And it wasn't really until this breakdown that they put the pieces together and realized, oh my gosh, we got to do something here. So from that point forward, they put a plan of action into place that, really helped facilitate the necessary vision development for me to help me soar in life. So I did office-based vision training. I did sensor integration-based occupational therapy every week. And because of the consistent nature of the treatment, it really all came together for me around the fourth grade or so, where my eyes, my brain, my body finally started working together and really this confidence that was hidden emerged. And I became a strong athlete. I started to enjoy reading. I developed interpersonal communication skills that allowed me to feel confident in space and to really understand my sense of self in space. And I say now that I turned this kind of disability into a strength where I could rely on vision to gain an advantage in the world. And what was really wonderful is, I continued with the therapies. Obviously, I've transitioned over time with, from patient to clinician. But, we can now accomplish what happened for me in years in a matter of months.
Wow.
And it's so cool. I look at this as now I'm on a mission. I'm here so that others don't have to struggle the way that I did. And
Hmm.
so now continuing to make vision therapy more accessible and, refining the standards of practice with it and, continuing to also innovate and be on the leading edge of technology and therapies and science and practices really has allowed vision therapy to become more accessible, efficient, and sustainable. So I'm just very grateful for that. And so fun now seeing myself and other patients knowing what's possible.
That's fantastic when you can take it, something that's happened to you, make, lemonade out of lemons and pass it on and pass it forward to help others.
100%.
Great feeling. And what a, I mean, that's amazing that you had parents that knew exactly what to do. And so you had the resources there. So
Yeah.
your parents must be so proud.
And they are, and I have three kids. All three of my kids have been through occupational therapy. Two
Oh,
of the
wow.
three have been through vision therapy. The
Okay.
third's about to start next week. And, we know what's possible. We know what we can do to facilitate and accelerate development from so many angles, but especially from this eye-brain connection perspective.
Right. So I think the problem I'm guessing that you probably have is that a lot of people don't even know what vision therapy is, don't know what a developmental optometrist is. So maybe you could explain that for people.
How'd you know that was such a massive problem? Yeah,
Yeah.
100%. So, um, I think the simplest way to understand this is really recognizing that there's a massive difference between our eyesight and our vision.
Mhm.
And most eye doctors are trained on this kind of heavy pursuit of seeing the tiny letters far away on the letter chart and intervening when there's disease. And that's important, but there's so much more to vision than just eyesight. I
Right.
look at eyesight as a symptom. It's that's what glasses are for. Vision is entirely brain, and vision problems are brain problems. So if we look at vision as our ability to track our eyes, converge, focus, process information, how we can make sense of the world around us, and then direct the appropriate action, vision problems after this webinar, I mean, people are going to realize like these are everywhere and they're
Mhm.
often hidden until you know what to look for. We're going to know what to look for today. But a developmental optometrist is somebody with this specialty in function on top of structure, but with much more of a proactive model rather than the standard medical reactive model, which everybody knows all too well. And a developmental optometrist evaluates and treats how somebody's eyes move when they're reading, how they focus together, how they converge together, the brain takes the information from the eyes, can organize it, filter it, make sense of it, and then direct the next action that's needed. And that goes way beyond just, whether you need glasses to see something clearly or not. But I really kind of identify myself more as a neuro-optometrist rather than a developmental
That's a
optometrist.
good way to put it. Yeah.
So a neurooptometrist, it's specialized training and clinical experience in visual problems, deficits that are a direct result of physical disabilities, traumatic brain injury, neurological insults. But
Mhm.
it's, an understanding of how specific visual dysfunction relates to symptoms, activities of daily living, performance, all of that. So I think to me, that is an umbrella that developmental optometry fits underneath.
Mhm.
But either way, it's teaching the eyes, brain, and body to work more cohesively as a unit and to really allow vision to guide and lead like it's intended to, rather than interfere like it is for so many of us.
Right. And what are some of those symptoms that parents might see when, if they're thinking maybe their kid might or might not need vision therapy?
Ooh, all right. So rather than list 1,000 of them, I
Yeah.
think there's several areas. So I think the first area that's really important is reading, learning, and academics.
Okay.
If we think about vision as our dominant sensory system, when vision is functioning like it's supposed to, the simplest of tasks like reading, writing, learning, navigating through space, social interactions, they're doing well. But when it's not functioning like it's supposed to, those can be so much harder and more frustrating than they're supposed to be. So it's estimated over 80% of what's learned in the classroom comes through the visual processing of information.
Right.
And sadly, 1 in 10 kids has a vision problem significant enough to impact learning.
Right.
So when children haven't developed these visual skills and abilities necessary to meet the demands, they experience symptoms like losing their place with reading, skipping words, skipping lines, words going into and out of focus, moving, becoming blurry, sometimes even double, difficulty copying off the chalkboard or going near, far, and
Mhm.
having that flexibility, and then also trouble focusing. And so that then often creates this negative association with sustained near concentration tasks, desk work tasks like reading and writing and learning. And then, I think on top of that, these problems are so much more prevalent than they've ever been and are exacerbated by the fact that our children are being exposed to screens and technology earlier than ever before,
Oh, yeah.
being asked being asked to read before they're visually ready. And so I can confidently say if you know somebody, a child in particular, who hates to read or prefers to be read to rather than reading on their own, who struggles in school, who's squirmy with desk work, there's a really good chance that they have a functional vision problem that's hidden, hopefully not anymore now, but
Right.
one that's treatable through this developmental optometry approach and specifically with vision training.
Right. Um, I have followed the work of Sally Goddard Blythe and Svetlana Moskotova, people like that, and they talk about how children with developmental delays, and especially children who don't crawl, what they call creeping, like on all
Yes.
fours,
Yep.
or they skip that phase, or they do it funny, like they drag a leg behind them, they butt scoot, just aren't wiring their body and their brain together very well. And so those kinds of babies are more likely to develop some kind of vision challenge later
I
on.
I love that you bring this up. I mean, the
Yeah.
fact that crawling is now not even considered a critical developmental milestone anymore. Like,
Yeah.
are you kidding me?
Yeah.
So every visual skill, every functional visual skill,
Mhm.
tracking, focusing, depth perception, eye teaming, we go on forever. These are skills that no child is born with. It
Mhm.
comes through our life experiences. It comes from learning from our life experiences and from the right sequencing of vision development. Kids who skip over crawling or walk too soon and the world goes from being static to all of a sudden dynamic have such a higher likelihood of developing a lazy eye or an eye turn
Mhm.
and an eye coordination problem because just like you said, that bilateral integration that comes from crawling, the reciprocal body movements, the core development, the having vision guide movement. I mean, those are the foundational skills from which we develop vision from. And so we see all the time infants who have an eye turn, a strabismus,
Mhm.
or seem like they have a lazy eye, amblyopia. And, in doing a really thorough history, you find out like, oh, they're actually always sleeping on the same side in the crib, or they're always being fed from one side, or
Right.
their
Torticollis.
crib. Absolutely. And so
Yeah.
the world is unstable and
Yeah.
it's less open peripherally as it could be. And as simple as like allowing for crawling to take place longer, or facilitating crawling with OT or PT,
Mhm.
or just knowing what to look for and how to then reroute development. If we think about the eye coordination problem as a byproduct of faulty motor development or sensory
Right.
integration challenges,
Mhm.
address those issues or help those issues, then vision often improves, sometimes improves dramatically on its own.
Right. I don't know how long you've been practicing, but have you seen, ever since the whole back to sleep campaign was started, I don't know, 20 years ago or something like that.
Yeah.
So I don't know if you know Patty Lemmer. Um,
Absolutely.
yeah, I
One of
figured
the
you.
most famous OTs other than my mom, I guess, let's say.
Exactly. And she was chairman of our organization for quite a few years, and we merged with her developmental delay resources as well.
Oh, I didn't know that. That's
Yeah.
outstanding. Amazing.
Yeah.
So
And
oh, go ahead.
she always said that when you put babies on their back to go to sleep, it's like they're neurologically upside down. And so you're putting them, you know, at a what's the word I'm looking for? It's like behind the eight ball. It's
Yeah, you're giving them a huge disadvantage. I mean,
yes.
from the development of their vestibular system, that internal
Yeah.
GPS system that lets you know which way is up and down and left and right.
Mhm.
I mean, there's a reason why tummy time matters and why
Yes.
tummy time is so crucial for life. I've got a fascinating story. We have